Hi, today I am going to be starting an IV on my patient. I'm also going to be giving her a dose of 20 milligrams of furosemide. Furosemide is 20 milligrams for 1 milliliter, so that means I will be giving her 1 milliliter. The first thing I'm going to do is check my orders before I enter the room. I'm also going to make sure that all of my supplies are not expired and are all valid and secure. So, let's enter the room. Hello.
Hi,
I'm gonna sanitize my hands. How are you doing today?
I'm doing good.
My name is Lauren, and I'm gonna be your nurse today.
Mm-hmm.
Name and date of birth.
Ivy Armstrong, March 9, 1964.
Okay, I see here in the record it says that you have some allergies. What are they?
Latex allergies.
Latex allergies. Okay. What happens to you when you have an allergic reaction to latex?
I'm actually not able to breathe.
Ooh. Oh no. Well, we won't use any latex. Cover your eyes. Lights. I need to see what
Oh.
you're doing.
Oh,
Is it okay with you if I raise your bed?
yeah, sure.
So why are you here today?
I'm actually having some fluid retention problem. I'm unable to, I feel like I'm having a lot of fluids lately.
Yeah, just some fluid overload issues. Well, that's possibly why they ordered you some Lasix. Your doctor has requested that I put an IV in and give you some furosemide. Have they explained that to you?
Yes.
Okay. Well, I'm going to also clean this table. Clean table. And I'm going to put my bucket down. All right. So, pardon me. So I'm going to give you 20 milligrams of furosemide, and that should help you with your water retention. But first, I need to get an IV in your arm. Why are you here? Oh, yes, you just said. And then, do you know where you're at?
I'm at the hospital.
Okay, do you know what today's date is?
February 10,
What year is it?
2023.
Approximately what time do you think it is?
I think it's around 2 o'clock in the afternoon.
Okay. Is this an okay arm to use? Have you had any mastectomies, or do you have any ports that I should be aware of? Any reason I can't use this arm?
Well, no, I don't remember anything.
Okay, so we've gone ahead and made sure that I can use her right arm. Okay. I'm just going to check out your veins real quick. Okay. Is it okay with you if I put some stuff on your bed?
Yeah, sure.
Okay. So, I'm going to open this first. I'm going to take the tourniquet and about 3 to 4 inches above where I want to put the IV on IV. I'm going to apply my tourniquet. Okay. It's going to be a little tight, Ivy. Okay?
Okay.
Doesn't hurt too bad, does it?
No, it's just some pressure.
Okay. I think I found a nice, juicy one. So I'm going to snap, shake, and scrub. And it's especially going to help pop that vein up so I can make sure that yes, that is really the one I want. I'm going to give her arm a break while it dries. And I move on to setting up my J-loop. All right, so I'm going to open this and keep it nice and clean. Got alcohol swabs here. Just to be extra safe, we're going to scrub that. 20 seconds. 1920. I'm going to attach my saline. This is right there. And I'm going to make sure that when I want to open this, I can. I'm also going to just prime the line. Cap is gone. We're going to pretend that I did not just drop that cap. Clean cap goes back on, right like that. And then we're going to rest it in its nice little home right here. And like I said, I was gonna put some things on the edge of your bed, and you said that was okay, right?
Yep. Mm-hmm.
Okay. So, yep, that IV is gonna go right in that area beautifully. Okay. I'm just gonna open this, set that there, retie my tourniquet without touching the area that I would like to use, because that would contaminate it and I would have to clean it again. Okay. I'm also going to put my tape on my hand before I stick my patient. All right. Now, when we go to poke our patient, bevel is going to be up on the needle, as is this white button. We're going to come in, I'm going to anchor the vein below where I put the needle so I don't stab myself. And then when I go in, I'm going to go at a nice shallow angle. I'm going to push through until I see I have a flash. I'll lower it down and advance it a little bit. And then I'm going to push that catheter in. Push that catheter in. Yep. Now, before I pull this out, I want to occlude the vein and undo the tourniquet. I'm going to pull this away, hit that white button. Now it's not an issue. I have my J-loop, and I have this here. I'm going to connect that, and I'm going to pull back a bit. Yep. And then I'm going to flush it. And I don't see any, I'm looking for if I see any bubbles or a large collection of fluid there. I'm going to occlude it like that. Make sure I keep my catheter in place. And I'm going to tape this down while I get my Tegaderm out. Now, I made a little bit of a mess, and the Tegaderm won't stick if I don't dry this off. So, I'm going to peel here, and this is going to go on the back of my hand because that's not what I wanted to peel, but that's okay. Now, these little pants are going to go right up against there, and I can see in the window, nice and snug, so that if this clots off, we can just change this out and that catheter will be fine. Peel off the manila portion because it wants to stick. No sticking. Come on. Unstick. There we go. Peeling this off. Now that that's in place, I'm going to be throwing that away. And before I walk away, I'm going to say that this was done on 2/10/23 at 3:21, so 15:21, and my initials. Then we are going to put this right here. How do you feel, Miss Ivy?
I'm doing good.
You're doing good. Okay, just a little salty, right?
Yep.
Okay. I'm gonna go get your medication now, okay?
Okay.
Take this, detach this, and also I want to tuck up this. Let's leave it straight until we put the medicine in. That's right. And always clean up as you go. Make sure that everything that you want to go in the trash goes in the trash. The things that you want to go in the sharps go in the sharps. I'm pretending that's a trash can right now. Okay. Thank you, Miss Ivy. I'll be right back.
Okay, I'll wait for you.
All right. Actually, while I go, I'm also going to lower the bed because she could fall out while I'm gone,
Okay.
and then that would be bad. Miss Ivy, do you have a call light?
Yep, I have.
Okay. If you need me in the 5 minutes that I'm gone, push the button. Okay?
Okay.
All right. Time for the first. I'm now going to go to the med room I'm going to go to the Pyxis. Hello, Pyxis. I'm going to
Hello.
check it against the MAR and see that, yes, this is my furosemide that I need. And then I'm going to make sure that I take 2 syringes of normal saline. I need to make sure I have my other small syringe and a needle to draw up the medication. Don't forget the red cap so you can carry it from one place to the next. This is my workstation. All right. Now that was my first med check. This is going to be my second med check. I'm actually quite concerned that this won't be enough. That's okay. All right. I need more gloves. We're going to grab it. Put on new gloves. Okay, so we're at the point where we need to draw up our 1 milliliter. I need to take this out, attach it to the syringe, uncap it, pull back 1 milliliter of air. Pull back 1 milliliter of air. I'm going to put 1 milliliter of air into this container. So air to air. And then we're going to see if this works. Keep the bevel in the liquid and pull back 1 milliliter. Ooh, I might empty this vial. All right, I have 1 milliliter. I'm going to close my safety. Detach this, make sure it goes in sharps. And I'm going to apply my red cap so that I can walk from one location to the next. Okay, I'm going to take my saline flushes with me, and that'll be that. So over here, I'm going to knock and I'm going to say, hello again, Miss Ivy. Name and date of birth again, please.
March 10, 1979, Ivy Armstrong.
Okay, good. I'm going to raise your bed up again. It seems to be locked since I pushed on it with my hand. I just want to get you high enough for me. Here, waist height. Okay, I'm going to do my final check for my final med check in my computer. Okay, Miss Ivy, I'm going to give you 1 milliliter of furosemide via IV right now for your water retention. And I'm going to scan it in the computer. Beep. All right. Now, when I go to give this, first, I am going to make sure that I scrub this port. Scrub this. It's clean. We're going to attach this here and make sure, I'm going to pull back a little bit, make sure that I get some pullback. Okay, I do. And then I'm going to, oh, make sure you take the clamp off. Pull back a bit, and it's, yes, it's flashing, and it's flushing. Hooray. Now, if I put this down, I have to get the new one out. I don't want to get the new one out. So we're going to take that red cap off, make sure that we are at 1 milliliter and that it is no air bubbles. All right, now, Miss Ivy, I'm going to push this over the course of a minute, and I'm going to do this nice and slow. 1 minute, 60 seconds. All right, so we have just pushed our furosemide 1 milliliter of 20 milligrams per milliliter over 60 seconds. I am now going to continue to flush the same amount, 1 milliliter of normal saline over the same amount of time to make sure that we push what's left in the tube into the patient. So for 60 seconds, we go flushy, flushy, flushy. All right, 59, 60. That's 1 milliliter. I'm going to make sure that I keep that throw away. Tape this back up so that it's in a loop and it's out of the patient's way and they're not fiddling with it and it's not going to come out. We're going to clean up and say thank you, Miss Ivy. Do you need anything else before I go?
No, I'm good.
Okay, do you have your call light?
Yep.
Okay, you have your call light. You don't need anything else.
I just
So-
want to watch my favorite Star Wars.
Star Wars?
Yep.
Okay, I hope you enjoy Star Wars. Before I go, I'm going to type everything into the computer. All right. Okay. Thank you so much. Do you want the lights off while you watch Star Wars?
Yes.
Okay. We'll go ahead and turn those lights out for you. Here we go.
Bye. May the force be with you.